How does a brain tumor biopsy procedure work? Have you ever wondered how doctors diagnose brain tumors? A brain tumor biopsy is a vital procedure that helps obtain a small tissue sample from a brain lesion. This sample is crucial for determining the type of tumor and guiding treatment options. Let's break down how this procedure works step by step. First, preparation is key. The patient's head is positioned and secured, often using a device to keep it still. Imaging scans, like magnetic resonance imaging or computed tomography, are performed to locate the tumor accurately. These images are then fed into a computer navigation system, which acts like a GPS for the surgeon during the biopsy. Next comes the incision and access. A small area of the scalp is shaved and cleaned. The surgeon makes a tiny incision in the scalp to expose the skull. They then drill a small hole in the skull, known as a burr hole, which is about the size of a dime or a quarter. This allows access to the brain tissue beneath. Now let's talk about the actual sampling. Using the computer-guided navigation system, the surgeon carefully inserts a thin, specialized biopsy needle through the burr hole. This needle is directed along a predetermined path to the targeted lesion. The depth, angle, and trajectory of the needle are precisely controlled to minimize any disturbance to healthy brain tissue. Once the needle reaches the lesion, the surgeon extracts a small tissue sample. After obtaining the sample, a preliminary analysis may be performed during the procedure to ensure that enough tissue has been collected. If needed, additional samples can be taken for more detailed pathology. Once sampling is complete, the needle is withdrawn, and the dura, which is the brain's protective covering, is closed if it was opened. The scalp incision is then sutured, and a sterile dressing is applied. Recovery from the procedure is usually quick. The biopsy is often done under general anesthesia, but in some cases, patients may remain awake if the lesion is near critical areas of the brain. This allows for real-time monitoring of speech or movement. The hospital stay can be short, sometimes just for the day or overnight. Sutures are typically removed within 10 to 14 days. There are two main types of brain tumor biopsies. The first is a stereotactic biopsy, which is the most common method. This approach uses imaging guidance and a small burr hole to target the lesion with minimal disruption. The second type is an open biopsy, or craniotomy, which may be necessary if a larger tissue sample is needed or if there is a higher risk of bleeding. In some cases, neuroendoscopy may be used to access tumors near the brain's fluid-filled spaces, using a thin tube with a camera to guide the sampling. Overall, a brain tumor biopsy is a carefully controlled surgical technique designed to safely obtain diagnostic tissue while prioritizing brain health and patient safety. This procedure is essential in diagnosing brain cancer and other brain diseases, helping to guide treatment decisions. Always consult with healthcare professionals for personalized medical advice regarding any concerns you may have.